private companies that are interested in getting into this space and coming up the scale quickly. We are interested in those companies, and we're interested in investing in those companies, and they should contact us at Empire State Development Corporation. Also restarting life, the state budget, not just this state, but every state budget has been decimated by this situation. We shut down the economy. People aren't working. They're not paying income taxes. Businesses aren't operating. So our budget just collapsed, right? Our revenues just collapsed. You want to restart the economy, you have to help restart the local governments. And that's going to be a federal act. I don't have the capacity as a governor, no governor does, to generate revenue in a positive way from an economy that's not operating. That is going to be a federal stimulus bill. There's no other way to do this. And it has to be a stimulus bill that actually understands you have state and local governments that have to be brought up to speed and functioning if you want to facilitate this restarting of the economy. Federal government passed some legislation. As I've said at the time, it was woefully inadequate from New York's point of view. We then have had some time to actually study the legislation. It actually gets worse when you read it, and it's not even what was represented to us initially. So I'm sending our congressional delegation a letter today saying the past legislation did good for the nation. I have no doubt gave aid to a lot of people and places that needed it, but it was not fair to New York, and that has to be remedied in any legislation that goes forward. The last point, I know it's been a frustrating 37 days, but it's only been 37 days on the other hand. I know it feels like a lifetime. It's been so disruptive, so abrupt, so frightening, so disorienting, but it's only been 37 days, right? Everything in context and everything in perspective. I know it's tough to get up every day, and this is like Groundhog Day, living through this bizarre reality that we're in. It's even more difficult, I think, with the weather changing, and you feel the seasons changing, and it's getting nicer, and you start to open a new book of possibilities, and now the weather's getting nice, and I should be getting outdoors, and I should be doing this, and I should be doing this. I get it. But it's only been 37 days. And I started by saying those numbers of cases, that's not arbitrary. What we do affects the number of cases. Our behavior affects the number of cases. We're generating the cases. They're not descending on us from heaven, right? It's our behavior. So it's been 37 days. The 1918 pandemic that we talk about peaked in New York for 6 months. It came through in 3 waves, and it peaked for 6 months. 30,000 people died in New York during that pandemic. Why? They didn't react the way we did. They didn't know as much as we know today. They didn't have the same drug therapies. But we are changing the curve in that virus growth. You see that plateauing. That's because of what we are doing. If we don't do what we are doing, that is a much different curve. And that's what happened in the past. So social distancing is working. Well, you shut down all the businesses. I know. Well, you shut down all the schools. I know. But it is working. That's why you see those numbers coming down. If we were doing the same rate of interaction, those numbers would still be going up. So to the extent we see a flattening or a possible plateau, that's because of what we are doing, and we have to keep doing it. I know it's hard, but we have to keep doing it. And to the extent it takes an effort, Remember, at this time, it is about we, and it is not about me. I know what I would like to be doing. I would like to be going, it's motorcycle weather for me. It's time to get out on the water. It's time to go hiking in the Adirondacks. I get it. It's not about me. It's not about me. What I do will affect other people. It will affect my family. It will affect other people. It will affect people in those emergency rooms who are killing themselves every day to keep other people safe. I get infected, I will affect them. So we all talk about society and community and interconnection and interrelation and family, and life is bigger than us. Now is the time to live that, right? Now is the time to live that. So when you feel that need, I have to do this. It's not about me, it's about we and what's good for all of us. And my health is in your hands. And your health is in my hands. And the health of those healthcare workers and those first responders and all those people who have to show up to work every day to keep society functioning, we are responsible to them also. So to the extent it's hard, I get it. But maybe if we think about it through a different lens, a broader lens, it'll be a little easier. So let's not get complacent. We have to stay disciplined, we have to stay smart, we have to stay safe, and we do that by staying at home, and we will get through this together. Questions?
The Pentagon said yesterday that the Comfort is meant to treat trauma patients and that they could isolate COVID patients in a small number. I know you said that they are going to be treating a smaller number of patients, but will the ship be able to care for even that number of COVID patients safely?
I spoke to General Shaughnessy, I spoke to the President, I spoke to the Vice President, and I spoke to Northwell, who's helping manage the Comfort. When you transition from General Shaughnessy, I spoke to the President, I spoke to the Vice President, I spoke to the capacity of managing 1,000 beds down to 500. When you transition from General Shaughnessy, I spoke to the President, I spoke to the Vice President, I spoke to the capacity of managing 1,000 beds down to 500. When you transition from General Shaughnessy, I spoke to the President, I spoke to the Vice President, I spoke to the capacity of managing 1,000 beds down to 500. When you transition from General Shaughnessy, I spoke to the President, I spoke to the Vice President, I spoke to the capacity of managing 1,000 beds down to 500. When you transition from General Shaughnessy, I spoke to the President, I spoke to the Vice President, I spoke to the capacity of managing 1,000 beds down to 500. When you transition from General Shaughnessy, I spoke to the President, I spoke to the Vice President, I spoke to the capacity of managing 1,000 beds down to 500. When you transition from General Shaughnessy, I spoke to the President, I spoke to the Vice President, I spoke to the capacity of managing 1,000 beds down to 500. When you transition from General Shaughnessy, I spoke to the President, I spoke to the Vice President, I spoke to the capacity of managing 1,000 beds down to 500. When you transition from General Shaughnessy, I spoke to the President, I spoke to the Vice President, I spoke to the capacity of managing 1,000 beds down to 500. When you transition from General Shaughnessy, I spoke to the President, I spoke to the Vice President, I spoke to the capacity of managing 1,000 beds down to 500. When you transition from General Shaughnessy, I spoke to the President, I spoke to the Vice President, I spoke to the capacity of managing 1,000 beds down to 500. When you transition from General Shaughnessy, I spoke to the President, I spoke to the Vice President, I spoke to the capacity of managing 1,000 beds down to 500. When you transition from General Shaughnessy, I spoke to the President, I spoke to the Vice President, I spoke to the capacity of managing 1,000 beds down to 500. When you transition from General Shaughnessy, I spoke to the President, I spoke to the Vice President, I spoke to the capacity of managing 1,000 beds down to 500. When you transition from General Shaughnessy, I spoke to the President, I spoke to the Vice President, I spoke to the capacity of managing 1,000 beds down to 500. When you transition from General Shaughnessy, I spoke to the President, I spoke to the Vice President, I spoke to the capacity of managing 1,000 beds down to 500. When you transition from General Shaughnessy, I spoke to the President, PD will be doing what they need to do. I made it clear yesterday that these social distancing regulations are not just pleas, they're regulations. You can be fined for it. We increased the fine to make the point that was serious. I'm sure the NYPD will be enforcing it. But also people have to understand. I understand religious gatherings. I understand the Orthodox community, Jewish Orthodox community. I'm very close to them, and I have been for many, many years, and my family's very close to them. But now is not the time for large religious gatherings. I mean, we paid this price already. We've learned this lesson. That was New Rochelle and Westchester. So please, now is not the time. You do no one a service by making this worse and infecting more people. Joseph?
There's been a lot of reports that communities of color have been particularly hit hard by the virus. Do you have a sense yet if that's been the case in New York? And you've been putting out a lot of data, gender, age, updating it daily. Has it been difficult to get those racial breakdowns? And what are you doing to get those?
So the hospitals actually don't report the race information directly to the state. So what we end up doing on the back end is calling the coroner's offices around the state after the death has been reported. So there has been a lag. We understand people want that information. We want that information too, and we'll have it this week.
Is there any sense, though, Dr. Zucker, that there has been that trend where it has affected communities of color?
So one of the challenges is that some of the communities have challenges with their health in general. They're more apt to have some of the challenges with asthma and diabetes. And so anytime anyone who has underlying medical conditions ends up with this virus or any other virus, it puts them more at risk.
Do you have any update on the unemployment website? I know, Phyllis, you talked yesterday about working with Google. Is there any progress there?
There is progress there, and we'll have that new interface up and running by Thursday. And we've actually worked with Verizon. A lot of the problem was the lines were crashing because the volume was so extreme. We've now moved 80% of the incoming calls off of the Verizon system and into call centers, and so you should start to see some easing up on that today. And again, we just ask people to remain patient as we get this resolved.
Governor, you promised an executive order on Friday regarding ventilator redistribution, and I believe that executive order was also going to cover other things. That still hasn't appeared. Is there a reason for the delay?
No, I'm going to issue an executive order today on everything that I've mentioned, the fines, et cetera, today.
What else will that cover? That will cover
Everything we've discussed to date.
Some lawmakers have suggested that that's going to be voluntary now, the quote-unquote taking of ventilators, that the Health Association put out something saying it's going to be a voluntary taking of those. Is that how you...
Joseph, it was always, the hospitals tell us what they have, quote-unquote, available, meaning unused, and they're not going to use it in the foreseeable future. So it was always of the equipment that you believe, you hospital, believe is available, if the state lent 20% of the available units, as you define available, that would be 500. And 500 ventilators was a big deal, especially 2 weeks ago. Frankly, since then, other things have happened. We have 1,000 ventilators from China. California freed up 500 ventilators. Oregon sent 140 ventilators. State of Washington freed up, I think, 400 ventilators or something like that. We've also acquired an additional 500 ventilators. So we're not in the position that we were in. But that's what it always was. A hospital says we have available, by their own definition, unused inventory. We're not using for the foreseeable future. 20% of that number, leaving them with 80% of the unused, was 500 ventilators.
That sounds like a big change from what you were saying on Friday, though.
No, that's what I was saying.
Governor, what are your thoughts on getting a presumptive line of duty death benefits similar to that was passed after 9/11 for state and city workers who died of COVID?
It's something that I think is going to come up, and I think it's an important thing to look at. I'd also like to find a way to say thank you to these healthcare workers who are out there every day. We talk to them on the telephone, but gee, what they have done is just incredible, just incredible. And not just the healthcare workers. I mean, the healthcare workers, just think of the mindset to walk into that ER every morning, putting on these gowns, putting on all this protective clothing, having to change the protective clothing several times a day, seeing people pass away, and then go home and deal with the stress at home. But also the first responders, the transit workers. You look at the rates of sickness. I mean, they know what they're exposing themselves to, and they still do it. I mean, just God bless them.
Do you have plans to grant clemency to a large number of, or just any inmates in the state prison system to curb this corona outbreak?
We're looking at that, any way we can, we are, and we're looking at that continually. I don't think there's anything new on that right now, but it's something we're exploring all the time.
Is there any specific plans that you're considering or any specific models?
We've done a number, but nothing right now. Are there any new?
We've done about 700 parole violators statewide. Those are people who were deemed to be low risk to public safety and also high risk to COVID. And so we have done that so far, and we're continuing to evaluate it on an ongoing basis.
I think the promise was about 400 people to come out of Rikers. So far, that's been about 130 people have been released. Is there a reason for the
I
lag?
think we've done about 240 out of Rikers so far of the 700 statewide, but we can get you the exact number,
That's a
Jesse.
fresh figure. And Governor, on a more kind of psychological, philosophical issue, 730 people died. These numbers keep rolling out, but it's easy, it would seem, to get numb to these sorts of, stats. How do you counter that? How do you impress on people that these are human lives, that this is an enormous human catastrophe?
Jesse, if they, I hear the point. I guess one could get numb to the numbers. That's why I said, remember, every number is a human being behind that and a family. For myself, I can tell you, the last thing I do is get numb. I can tell you for the hospital staff that goes through this, they're not getting numb. For the families who are suffering, they're not getting numb. The pain is increasing, the grief is increasing. I mean, you see those pictures on TV of getting to a situation where you have to put bodies in trucks, in parking lots. I mean, how you could get numb to any of this. I can't imagine, especially New Yorkers, that we lose the humanity of this. It's something I struggle with every day. I try to think of the opposite, that, we are doing good, because you can't save everyone. This virus is very good at what it does, and it kills vulnerable people. That's what it does. And it does that very well. And we can't stop that. The question is, are you saving everyone you can save? And there the answer is yes, and I take some solace in that fact. Our healthcare system is operating. I don't believe we lost a single person because we couldn't provide care. People we lost, we couldn't save despite our best efforts. But no, I don't see the numbness, and I don't believe New Yorkers see the numbness. I think the frustration of an individual situation can cause you to do irresponsible things, to go out more than you should, to disregard social distancing. I think that's an issue, and that's what I've been trying to address.
Governor, I know we're not there yet, but when people do eventually start getting back to work, will it be the reverse of the reduction, meaning they'll go back in spurts of 25% at a time or 12 or something like that?
I don't know. It's a good question. I think they go back It's my opinion, it's not a fact. I think, and we're working on a plan with Connecticut and New Jersey, because when we go back together. I think we go back with people who have tested that they are negative, or people who have tested that they have the antibodies, which means they had the virus and they're immune from the virus, or we go back with younger people going first, still protecting, isolating the vulnerable. But if it's waves, I think those are the waves.
Is there any proof you can't get reinfected?
Say it again.
Is there any proof you can't get reinfected if you have the antibodies? Is there
Let's
proof
ask
that-
Dr. Zucker, your friend.
So usually when you have a virus, you develop antibodies, you don't get it again. There was one report out of China where they suggested that maybe there were some cases, but that hasn't been confirmed yet.
Are you concerned that the temporary hospitals will be accepting significant numbers of patients until after the peak is passed?
A larger number of what, I'm sorry?
Are you concerned that the temporary hospitals won't be accepting significant numbers of patients until after the peak is passed?
A significant number of patients?
Mm-hmm.
No, they're ramping up now. The Javits Center and the Comfort you're talking about? The Javits and Comfort, well, there's two separate situations. When I say we have about 90,000 bed capacity, we brought online additional beds, right? Two ways. Number one, every hospital had to increase capacity by 50% with a goal of 100%. Every hospital has increased capacity 50%. That's why you see hospital beds in conference rooms and lobbies, et cetera. Second, we built temporary emergency facilities, primarily around downstate New York. They may or may not be used depending on whether or not we need the beds. The Javits and the Comfort we are using, and they're ramping up now. I'm going to go speak to the hospitals. Thank you.
Grocery store workers are going to be put at further risk? Is there any plans on how to address grocery workers and their safety?
Grocery store workers, transit workers, first responders.
This morning, some potential good news in hard-hit New York.
Again, would suggest a possible flattening of the curve.
Daily hospitalizations are down, so are ICU admissions and daily intubations. And though deaths are still rising, the increase has been stable for 2 days. Still, Governor Andrew Cuomo is warning New Yorkers not to let their guard down.
If we are plateauing at a very high level, and there's tremendous stress on the healthcare system.
President Trump has now agreed to allow the 1,000-bed floating hospital, the USNS Comfort, to treat COVID-19 patients. But overnight, a crew member was isolated after testing positive for the virus. The Navy says it will have no impact on the Comfort's mission. Meanwhile, there's another 2,500 beds at the Javits Convention Center, which has been converted into a massive hospital and is now open. And possibly another 200 more beds next week at St. John the Divine, the largest cathedral in America, which is working out logistics of opening its doors to the sick. All potential relief valves for doctors like Evelina Graber, who works at a COVID-19 unit at North Shore University Hospital and says all of her patients are seriously ill.
You can actually smell fear. You smell death.
Every day. In Harlem, frustrated medical workers are demanding more protective equipment.
To have an N95 mask every day is nothing. That's like us begging for crumbs when we need dinner.
New York City accounts for nearly a quarter of the nation's surging death toll. A funeral home in Brooklyn says it's running out of body bags.
We're overwhelmed. My staff they're on wit's end.
As city officials urge New Yorkers to wear face coverings when going outside, the governor is furious that some are not properly social distancing, and he has doubled the fine from not doing so from $500 to $1,000.
Prime Minister.
He's been leading the British charge against coronavirus. But this morning, Britain's Prime Minister Boris Johnson is in intensive care focused on the fight of his life, his own difficult battle with the virus. Politics pushed aside, European leaders like the French president, who've so often disagreed with Johnson, tweeting support.
When you're in intensive care, it's a big deal. So
President Trump hoping the Prime Minister will pull through.
Americans are all praying for his recovery. He's been a really good friend. He's been really something very special, strong, resolute, doesn't quit, doesn't give up.
On Thursday, Johnson was outside Downing Street cheering Britain's health workers. He looked visibly sick in a video message Friday.
I still have a temperature.
On Sunday, he was moved to the hospital, and yesterday, just hours after tweeting, "I'm in good spirits," he was given oxygen and moved to intensive care. The Queen being kept informed, his Foreign Secretary, who will run the government in his absence, visibly stunned.
Well, the government's business will continue, and the Prime Minister is in safe hands with a brilliant team.
His pregnant fiancée, who lives with him in Downing Street, has also been sick, but says she's getting stronger. Initially, like so many, Johnson failed to take coronavirus seriously, shaking hands on a hospital visit.
There were actually a few coronavirus patients, and I shook hands with everybody, you'll be pleased to know, and I continue to shake hands.
This morning, Britain is waking up to an unprecedented crisis. Its hospitals overstretched, treating the victims of the virus, including the Prime Minister.
Continue to shake hands.
This morning, Britain is waking up to an unprecedented crisis. Its hospitals overstretched, treating the victims of the virus, including the Prime Minister.
Continue to shake hands.
This morning, Britain is waking up to an unprecedented crisis. Its hospitals overstretched, treating the victims of the virus, including the Prime Minister.
To shake hands.
This morning, Britain is waking up to an unprecedented crisis. Its hospitals overstretched, treating the victims of the virus, including the Prime Minister.
To shake hands.
This morning, Britain is waking up to an unprecedented crisis. Its hospitals overstretched, treating the victims of the virus, including the Prime Minister.
To shake hands.
This morning, Britain is waking up to an unprecedented crisis. Its hospitals overstretched, treating the victims of the virus, including the Prime Minister. This morning, Britain is waking up to an unprecedented crisis. Its hospitals overstretched, treating the victims of the virus, including the Prime Minister. This morning, Britain is waking up to an unprecedented crisis. Its hospitals overstretched, treating the victims of the virus, including the Prime Minister. This morning, Britain is waking up to an unprecedented crisis. Its hospitals overstretched, treating the victims of the virus, including the Prime Minister. This morning, Britain is waking up to an unprecedented crisis. Its hospitals overstretched, treating the victims of the virus, including the Prime Minister. This morning, Britain is waking up to an unprecedented crisis. Its hospitals overstretched, treating the victims of the virus, including the Prime Minister. This morning, Britain is waking up to an unprecedented crisis. Its hospitals overstretched, treating the victims of the virus, including the Prime Minister. This morning, Britain is waking up to an unprecedented crisis. Its hospitals overstretched, treating the victims of the virus, including the Prime Minister. This morning, Britain is waking up to an unprecedented crisis. Its hospitals overstretched, treating the victims of the virus, including the Prime Minister. This morning, Britain is waking up to an unprecedented crisis. Its hospitals overstretched, treating the victims of the virus, including the Prime Minister. This morning, Britain is waking up to an unprecedented crisis. Its hospitals overstretched, treating the victims of the virus, including the Prime Minister. This
Wisconsin can. You're going to exercise your right to vote and consider. You're going to exercise your right to vote and consider how I put this one together. You're going to exercise your right to vote and consider. How I put this one together.
Recline and work out.
You're going to exercise your right to vote and consider.
That was not the time to be playing frisbee with your
How I put this one together.
Recline and work out.
You're going to exercise your right to vote and consider.
That was not the time to be playing frisbee with your
How I put this one together.
Recline and work out. In New York, state parks remain open with some
How I put this one together.
Recline and work out. Other activities may be a little less smart after Nassau County, Long Island reopened its golf courses. In New York, state parks remain open with some across the coast in California, fines and handcuffs for banned behavior. State parks remain open with some Pacific. Across the coast in California, fines and handcuffs for banned behavior.
As much as I hate to see that happen,
state park closed beaches.
as much as I do think it's probably the prudent move at the moment.
Beaches buried in the middle
I
of
hate to
debate
see
all
that
over
happen.
the country. Georgia state park were ones in his state drawing heavy criticism.
In my opinion, they just loaded a gun and pointed it at
beaches.
As much as I do think it's probably the prudent move
Access to sand
at the
parks has
moment.
been shut off for weeks. Buried in the middle
I
of
hate to
debate
see that
all over the
happen.
country with varying levels of concern. Georgia state park were ones in his state drawing heavy criticism.
In my opinion, they just loaded a gun and pointed it at
As much as I do think it's probably the prudent move
Access to sand parks has been shut
Beaches
off for weeks. Buried in the middle of
I hate to
debate
see
all
that
over the
happen.
country with varying levels of concern. Georgia state park were ones in his state drawing heavy criticism.
In my opinion, they just loaded a gun and pointed it at
As much as I do think it's probably the prudent move.
Access to say is essential.
I think it is the absolute antidote to despair.
Some, like Governor Cuomo, urging people to parks has been shut off for weeks. Buried in the middle of
I hate to
debate
see
all
that
over the
happen.
country or face $1,000 fines.
It's not really about the fine. Nobody wants the money.
Varying levels of concern. Georgia state park were ones in his state drawing heavy criticism.
In my opinion, they just loaded a gun and pointed it at
Antidote to despair.
Some leaders face $1,000 fines.
It's not really about the fine. Nobody wants the money. We want the compliance.
Stopping the spread of this vicious disease, one action at a time.
So, Sam, most states do have those shelter-in-place orders right now, but an exception for going outside and getting exercise seems to be the rule in most places. So how should people proceed?
Yeah, that's a very delicate question. Most of the states do have lockdowns. Almost all of them, Savannah, have some sort of exception for outdoor activity, including New York. But the keys here are twofold. One, you can't be within 6 feet of another person. And two, in many of those places, you have to wear a mask. But you could argue Governor Cuomo's message right now
levels of concern. Georgia, ones in his state drawing heavy criticism.
Something new, our series On Call, answering your questions about coronavirus. There's so much info out there, so it's hard to know what to believe. NBC medical correspondent Dr. John Torres.
In my opinion, they just loaded a gun.
Hey, Dr. John. So we started our news
Antidote to despair.
New Jersey appear to be flattening the curve. Now, a lot of people at home might be going like, yay, it's over. But where are we in this fight?
And Hoda, you're right.
Some leaders face $1,000 fines.
It's not really about the
of not getting it all of a sudden at once to overwhelm the hospital system, but it's happening because of all the different steps we're taking. And if we start relaxing on that
fine. Nobody wants the money.
Cannot let the guard down here.
All right. Well,
they want the compliance.
Stopping the spread of this vicious disease, one action at a time.
A bunch of people on them, a good or a bad.
So, Sam, most states do have those shelter-in-place orders right now, but an exception for going outside and getting exercise seems to be the rule in most places. So how should people proceed?
So eventually they're going to start mingling throughout the day.
Yeah, that's a very delicate question. Most of the states do have.
Just need a week, maybe 2 weeks of just
lockdowns. Almost all of them, Savannah, have some sort of exception for outdoor activity, including New York.
Ones in his state drawing heavy criticism.
Let's make
something new. Our series On Call, answering your questions about coronavirus. There's so much info out there, so it's hard to know what to believe. NBC medical correspondent Dr. John Torres. The president has been touting over and over in news conferences hydroxychloroquine. It's the
in my opinion, they just loaded a gun.
Hey, Dr. John. So we started our news
Antidote to despair.
New Jersey appear to be flattening the curve. Now, a lot of people at home might be going like, yay, it's over. But where are we in this fight?
I really think they should take it, but it's their choice.
And Hoda, you're right.
Some leaders face $1,000 fines.
It's not really about the
of not getting it all of a sudden at once to overwhelm the hospital system, but it's happening because of all the different steps we're taking. And if we start relaxing on that
fine. Nobody wants the money.
Cannot let the guard down here.
All right. Well,
they want the compliance.
Stopping the spread of this vicious disease, one action at a time.
A bunch of people on them, a good or a bad.
So, Sam, most states do have those shelter-in-place orders right now, but an exception for going outside and getting exercise seems to be the rule in most places. So how should people proceed?
So eventually they're going to start mingling throughout the day.
Yeah, that's a very delicate question. Most of the states do have.
Just need a week, maybe 2 weeks of just
lockdowns. Almost all of them, Savannah, have some sort of exception for outdoor activity, including New York.
Ones in his state drawing heavy criticism.
Something new. Our series On Call, answering your questions about coronavirus. There's so much info out there, so it's hard to know what to believe. NBC medical correspondent Dr. John Torres. The president has been touting over and over in news conferences hydroxychloroquine. It's the
in my opinion, they just loaded a gun.
Hey, Dr. John. So we started our news
Antidote to despair.
New Jersey appear to be flattening the curve. Now, a lot of people at home might be going like, yay, it's over. But where are we in this fight?
I really think they should take it, but it's their choice.
And Hoda, you're right.
Some leaders face $1,000 fines.
It's not really about the
of not getting it all of a sudden at once to overwhelm the hospital system, but it's happening because of all the different steps we're taking. And if we start relaxing on that
fine. Nobody wants the money.
Cannot let the guard down here.
All right. Well,
they want the compliance.
Stopping the spread of this vicious disease, one action at a time.
So, Sam, most states do have those shelter-in-place orders right now, but an exception for going outside and getting exercise seems to be the rule in most places. So how should people proceed?
So eventually they're going to start mingling throughout the day.
Yeah, that's a very delicate question. Most of the states do have.
Just need a week, maybe 2 weeks of just
lockdowns. Almost all of them, Savannah, have some sort of exception for outdoor activity, including New York.
Ones in his state drawing heavy criticism.
Something new. Our series On Call, answering your questions about coronavirus. There's so much info out there, so it's hard to know what to believe. NBC medical correspondent Dr. John Torres. The president has been touting over and over in news conferences hydroxychloroquine. It's the Hey, Dr. John. So we started our new to despair. New Jersey appear to be flattening the curve. Now, a lot of people at home might be going like, "Yay, it's over." But where are we in this fight?
And Hoda, you're right.
Some leaders face $1,000 fines.
It's not really about the fact of not getting it all of a sudden at once to overwhelm the hospital system, but it's happening because of all the different steps we're taking. And if we start relaxing on that,
Fine, nobody wants the money.
and I guard down here.
All right, well,
I want the compliance.
Stopping the spread of this vicious disease, one action at a time.
So, Sam, most states do have those shelter-in-place orders right now, but an exception for going outside and getting exercise seems to be the rule in most places. So how should people proceed?
So eventually they're going to start mingling throughout the day.
Yeah, that's a very delicate question. Most of the states do have
just need a week, maybe 2 weeks of just
lockdowns. Almost all of them, Savannah, have some sort of exception for outdoor activity, including New York.
Ones in his state drawing heavy criticism.
Something new, our series On Call, answering your questions about coronavirus. There's so much info out there, so it's hard to know what to believe. NBC medical correspondent Dr. John Torres. The president has been touting over and over in news conferences hydroxychloroquine. It's the Hey, Dr. John. So we started our new to despair. New Jersey appear to be flattening the curve. Now, a lot of people at home might be going like, "Yay, it's over." But where are we in this fight?
And Hoda, you're right.
Some leaders face $1,000 fines.
It's not really about the fact of not getting it all of a sudden at once to overwhelm the hospital system, but it's happening because of all the different steps we're taking. And if we start relaxing on that,
Fine, nobody wants the money.
and I guard down here.
All right, well,
I want the compliance.
Step at a time.
So, Sam, most states do have those shelter-in-place orders right now, but an exception for going outside and getting exercise seems to be the rule in most places. So how should people proceed?
So eventually they're going to start mingling throughout the day.
Yeah, that's a very delicate question. Most of the states do have
just need a week, maybe 2 weeks of just
lockdowns. Almost all of them, Savannah, have some sort of exception for outdoor activity, including New York.
Ones in his state drawing heavy criticism.
Something new, our series the president has been touting. Hey, Dr. John. So we started our new to despair. New Jersey
Mr. Trump said it was a good call and that Biden made several
to be flattening the curve. Now, a lot of people at home.
Some leaders face $1,000
and I asked him what should be done about
fines
because of all the different steps we're taking. And if we start relaxing
vote in person
on that,
Fine, nobody wants the money.
and I guard down here.
All right, well,
Mr. Trump said it was a good call and that Biden made several
or postponed.
Flattening the curve. Now, a lot of people at home.
Some leaders face $1,000
when I asked him what my one-on-one interview with former Vice President Joe Biden coming up and what should be done about
fines
because of all the different steps we're taking. And if we start relaxing
vote in person
on that,
Fine, nobody wants the money.
and I guard down here.
All right, well,
Mr. Trump said it was a good call and that Biden made several
or postponed.
flattening the curve. Now, a lot of people at home.
Some leaders face $1,000
when I asked him what my one-on-one interview with former Vice
We're here for them. We are the community.
It's definitely good to hear. You always want to hear that the wages are going up.
We work hard, we bleed, we sweat, we cry when it comes to these cars.
Without this pill, we die.
He's doing the best he can for the country, and they're getting in the way.
We're going to build the wall. We have no choice.
This is an emergency. There are 0 hours left to take action.
Because we're incarcerated doesn't mean that we should lose our right to vote.
This is the perfect time to graduate.
There's like a lot of shooting happening.
These are thoughtful voters who, more than anything, want candidates to cut to the chase.
NBC Nightly News with Lester Holt, covering coronavirus with facts over fear.
How do we know who belongs in isolation? What should we be conscious of? What's being worked on today?
At a time of national crisis, turn to the most trusted TV news anchor in America.
Need your true crime fix on the go? Dateline episodes are available as podcasts. Mysteries with a twist from the True Crime Original. Wow. Listen to Dateline wherever you get your podcasts.
You're watching NBC News Now. We've got some breaking news. This is all I've got left.
Who brought more to the caucuses?
It's news made for your streaming world. Live weekdays, 3 to 11 p.m. Eastern.
Manchester, from Washington. Why should your judgment be valued?
I'd stake my judgment against anyone out there.
Is party unity your concern right now, or is simply winning as many states as you can?
It's both. NBC Nightly News with Lester Holt.
If it's digging in on the issues.
Let's talk about money and politics.
If it's asking the questions you want to ask. How do you reassure those supporters that you will sustain this?
Just watch me.
If it's navigating the winding road to the White House. And if it's Sunday, it's Meet the Press.
The coronavirus outbreak. What's next? NBC News has in-depth coverage, answers to your questions, insight from medical experts, and up-to-the-minute live blog updates. For continuing coverage, turn to the networks and platforms of NBC News.
Apparently some good news for sports fans.
Let's get to it. That's right. First, the NFL moving forward with its plans to hold the 2020 draft at the end of the month. Now, they'll do it in a fully virtual format. That means the team's GMs, the coaches, and other personnel, they'll be at their own homes. They'll be communicating by phone, by video conferencing, maybe by Zoom. The draft was originally supposed to be held in front of fans in Las Vegas, but a draft is a draft.
That's a good sign, right? That's a good sign. Meanwhile, Major League Baseball, they're working on some plans to try and get their season started. According to multiple reports this morning, baseball could return as early as next month. One of the plans that's gaining steam right now calls for all 30 teams to play games with no fans in the stands, and they would play these games in the greater Phoenix area. Teams would play at Chase Field and various spring training facilities in the area as well.
And they said they wouldn't be in the dugouts. They'd be like in the audience 6 feet apart. So no dugouts, but
we could all use that distraction.
How do you tag someone out?
How do you tag someone?
Better than nothing.
Yeah.
Better than nothing.
You're
That's
right.
Mr.
It's been a long time since I played softball in 4th grade, but I do remember that.
Yeah, there is a tag.
One of the we're doing now, by the way, watching old games. Like on ESPN, you can watch some of the classics from 10, 15 years ago.
This morning on With You Today, the new federal guidelines that suggest even a quick trip to the grocery store these days can be kind of risky. And if you've tried to have your groceries delivered, it's tough to even schedule that order. So what are shoppers supposed to do? NBC investigative and consumer correspondent Vicki Nguyen is here to help us out. Hey, Vicki.
Hi, good morning, Hoda. Oh my gosh, getting groceries is no longer just a simple trip to the supermarket. We're already stressed about shortages. Now we're being told to avoid leaving home for the next week or so. So this morning we are finding new ways for you to pick up your groceries.
This morning, many Americans are wondering how to get food and other household necessities after this alarming warning from Dr. Deborah Birx, the White House coronavirus response coordinator.
This is the moment to not be going to the grocery store, not going to the pharmacy, but doing everything you can to keep your family and your friends safe.
Birx clarifying those headline-making comments on Monday.
And what I meant was, if you can consolidate, if you can send one person, the entire family doesn't need to go out on these occasions. So, maybe once every 2 weeks, we can do a grocery store and pharmacy shop for the entire family.
And that means the way we all shop will have to change.
Grocers have been finding innovative solutions and ways to meet the growing consumer demand in online sales.
Laura Strange represents the National Grocers Association, a group of 8,000 independent stores.
What exactly are grocery stores doing now to help meet this new demand?
A number of them are launching their e-commerce platforms and grocery delivery services.
National chains like Whole Foods, Fresh Direct, and Instacart are struggling to keep up with demand for online orders, up 150% compared to last year. Amazon, which owns Whole Foods and other grocery delivery services, said help is on the way, writing in a statement, "We are adding more delivery windows throughout the day and hiring over 100,000 positions across the U.S. and will continue to expand quickly to reach more customers." People are also turning to options like curbside pickup, offered by retailers like Target and Walmart. Kroger, the nation's largest grocery chain, says it's responding to increased demand by waiving its $4.95 fee for curbside pickup. But many on social media are saying these options don't work, with one person writing, "They no longer can offer curbside service because slots are full, delivery full too, and they are recommending not going into the store either. So how exactly are we supposed to get groceries now?" One idea, consider turning to services that can do the shopping and make deliveries, but it comes at a price. I tried Postmates.
Okay, so my Postmates order just arrived. There it is. I ordered 47 items, but only 20 of them arrived, and it took a lot longer than the original promised delivery time.
On top of the grocery tab, I paid $28 in fees. Postmates told us they would investigate our order, but added they are not typically used for large grocery deliveries. There's also TaskRabbit.
Hey, are you Sean? Yes, I am.
Our producer's delivery guy arrived in just 2 hours with all his groceries, but this time the fees totaled $34, what we agreed to up front. Also, check some of your local restaurants. Some are filling the gap and offering groceries and even meal kits.
Now, Postmates later told us they would be crediting my account, and they said they're working hard during these difficult times to meet the needs of their customers. And they did give me a heads up saying a lot of these items were just sold out at the stores.
Yeah, and you did get it in a couple hours, which I found surprising. They already. We got a lot more to get to. We've been collaborating with Facebook. We've got some questions. Melanie's got one for us. You know, trying to get that delivery slot time is almost impossible, and she wants to know why they are canceling pickup. Like if I want to go to the store and pick up my order.
I thought that question meant she was saying they were canceling the deliveries. So I haven't heard of that on social media or those requests. We are in contact with all of these major delivery companies. They say they're just experiencing overwhelming demand right now. They weren't designed to handle this, so they're hiring more people. But in the meantime, what are you supposed to do? So some tips here. Take stock of what's in your pantry. Just review what you already have. That might relieve some anxiety. You probably have more food than you realize. Then you're really going to want to check the websites of these delivery services throughout the day. You and I have experienced this. When that window opens up, just snag it. You can make adjustments until about 24 hours ahead of time. Yeah, that's super important. Also, you really want to consider your local independent grocery stores. A lot of them are now stepping up and offering the delivery and the curbside pickup as well.
We've got a question from Denise from Facebook. She wants to know if only one person should go to the store, or can her husband come with her because it makes it quicker? They can get through it quicker.
Yeah, you and I talked about this. The health experts are saying limit the number of people who are going to the store and also designate one person. But you can help speed things up by giving them a focused paper list so you can avoid being on the phone. If you must use your phone when you're shopping, consider putting it in a Ziploc bag or a plastic bag and then throwing that bag away afterwards. Look with your eyes, not with your hands. So just pick out exactly what you need to avoid touching more things than you need to. And then when you get home, wash your hands.
Right, and have a list. Don't just wander up and down the aisles.
Focused.
Okay, so Steve on Facebook has an interesting question. Let's listen.
Is it safer to make a quick trip to the grocery store yourself or have a stranger deliver your groceries to your home?
Good question.
Yeah, health experts say certainly there are risks to both, but really in this case, having that one delivery person dropping it off, contactless delivery is the best way to go because that's only one person you're coming into contact with.
All right, so here comes our most popular question on Facebook. This one comes from Stacy.
Do we need to disinfect and wipe down grocery store products and reusable bags?
That's a big one.
Yeah, experts are mixed on this, but they all agree it is a very, very low risk. Think about all of the things that have to happen. Someone sick has to touch that package. Then you have to touch that package. Then you have to touch your face in order for you to get sick. But it's possible because we are touching things all the time. In our house, we're taking maximum precautions, as Dr. Joseph Fair has recommended. We are wiping things down as they come in. Designate an area for the things you don't need right away. Let those sit for a day if you don't have wipes. But we're also washing our fruits and vegetables. Warm water is best. If you want, you can do a light soapy solution. Just make sure you rinse it all off.
Got it. All good advice. Vicki, thank you.
Inside the White House, NBC News has confirmed a heated weekend exchange. Presidential advisor Peter Navarro facing off against infectious disease expert Dr. Anthony Fauci. Navarro pushing hydroxychloroquine for treating COVID-19 patients based on anecdotal studies overseas. Fauci saying those studies are not scientific, and chloroquine, a drug used to treat malaria and lupus, also carries cardiovascular risks. But the president continues to endorse the drug.
I would love to go to a laboratory and spend a couple of years testing something. We don't have time. We don't have 2 hours because there are people dying right now.
New Jersey nurse Margaret Novins believes chloroquine and an antibiotic combination helped her recover from COVID-19.
Within 24 hours, my fever was gone. I was still short of breath. I still had to recover from that.
New York hospitals are using it in emergencies, but the governor is cautious.
Anecdotally, you'll get suggestions that it has been effective, but we don't have any official data yet.
Meanwhile, an Inspector General watchdog report has found hospitals nationwide reporting dire shortages of critical equipment, including testing kits, thermometers, and personal protection equipment, and receiving government supplies that expired a decade ago.
We heard an incredible plea from the hospitals about their efforts to keep staff safe.
And amid a widespread shortage of ventilators and shortage of the drugs used to place patients into comas for intubation.
Are crucial to ventilators working and the patients being able to recover and beat COVID-19.
Pharmaceutical companies are now ramping up production of those drugs, trying to keep up with the crushing demand.
Holy Name Medical Center in northern New Jersey is a community hospital, medium size. Many of the staff were actually born here. It was also one of the hospitals hit earliest and hardest by the coronavirus. 55 deaths so far, 175 infected people hospitalized.
Just checking everything out for you, okay? Just making sure all your lines are good.
Arlene Van Dyke, a single mother of two, has been an ICU nurse at Holy Name for 32 years.
I'm just going to assess them first.
At a time when family can't be there, bedside manner takes on new meaning. Each 13-hour shift brings new challenges.
Exhausting. Today was really rough.
Michelle Acito is the director of nursing.
The nursing staff have been amazing. Every time they go into a patient room, they know that not only are they the caregiver, but they are the stand-in family member.
And sometimes it is their family. 3 of Acito's relatives have tested positive for coronavirus, including her mother-in-law, Edna Acito, who was hospitalized here and celebrated her 89th birthday with nurses singing.
Happy birthday to you.
2 days later, she died.
They sang to her. She knew they were there. She was mouthing the words, and it was really just sweet. And adorable, and the family appreciated having that video, knowing that her last birthday here on Earth was celebrated with people around her.
This hospital, like so many, has had to transform during the crisis. It started with 19 ICU beds. By the end of this week, it will have 106. Many of those patients on ventilators for days and even weeks. Good news is in short supply, but last week there was a victory. the first patient to be successfully removed off a ventilator.
We see the sickest of the sick, so we forget that there's people that do well. So this was a huge thing for us.
For a hospital battling the worst of this virus, a welcome reminder that all their work is making a difference. Stephanie Gosk, NBC News, Teaneck, New Jersey.
Despite empty houses of worship, many are virtually packing the aisles from home.
Thank you for joining us.
Some even taking a safe route to confession. But in at least a dozen states where churches are exempt from stay-at-home orders and some where they're not, followers gather in number and in person as they did on Palm Sunday in Ohio.
There's God's law and then there's man's law. Me and my household, we put God's law.
And in Louisiana, a state with one of the highest number of COVID-19 deaths, Pastor Tony Spell says 1,200 people showed up Sunday. The massive crowd days after his arrest for hosting last week's service, which authorities say violated the governor's orders.
They would rather come to church and worship like free people than they have live like prisoners in their homes for 22 days.
And Pastor Joel Garza vows to keep his church doors open in Texas, where churches are deemed essential.
And I think it's utterly ridiculous that they're doing what they're doing.
With several states suspending in-person primary voting and religious holidays just days away, many wonder if states will soon toughen their stance on in-person worship as well and insist faith leaders serve online.
We're all together. We are, all one family. And I think that also gives a little bit of that spiritual strength as we face this crisis.
Together in spirit, finding prayer in a pandemic. Katie Beck, NBC News.
Overnight in Tennessee, a fourth death at this center. In New Jersey, 1/4 of nursing homes now have cases. And at Manhattan's